I feel like I owe you guys a little bit of a bump date. It's been a while since you've seen this little bump of mine. So this is what we got going on in the front. Just my little bump. I don't know how I'm 28 weeks right now. Like, I start third trimester today and I just like, I'm a little bit mind blown. Like, part of me feels like I've been pregnant forever because when I look back, like, I've been pregnant since October. And the other part of me is like, we still have a long way to go. And then there's another part of me that's like, time is ticking. Like, I have so many mixed emotions. In general, I love being pregnant. I mean, I have just loved growing this baby so far, and I can't wait to meet him. And part of me wants to be pregnant so much longer because I'm just enjoying it so much. And the other part of me is like, let's speed this up. I want to meet this baby. If this is your first time seeing my face, welcome to my channel. My name is Sydney. I'm a perinatal athletic therapist and postnatal fitness specialist, and I'm currently taking you guys through my first pregnancy, kind of week by week, things I'm experiencing, things I didn't realize were gonna happen, all of that kind of good stuff. And so if you would like to be a part of this journey with me, please feel free to subscribe and stick around for a while. I'm going to talk today about the symptoms that I've been experiencing in the past. I don't know when I posted that last video. I want to say it's been about 6 weeks, maybe? Or has it been about a month? I don't even remember. So the last one I did was weeks 18 to 22. So this is 22 to 28. And the reason I've spread it out a little bit more is just because I'm just not experiencing that many things anymore. So I talked to you guys about my glucose test. I did a day in the life about my glucose test at 25 weeks. So I'm not going to include that in this video, but I will include, I had a midwife appointment, my 4th one. So I'll chat about that a little bit in this video and just kind of the symptoms I'm experiencing and sort of what we are doing at this point in pregnancy. So we'll go through my symptoms really quick. I just have my pregnancy journal here. Yeah, I don't have all that many symptoms that are really, like, they're kind of intermittent. Like, there are some that I experience for a couple days and then they go away. And there's some that I experience like every once in a while. Like, I really don't have all that many symptoms other than like, he's just like flip-flopping around in there like a fish and putting a lot of pressure downwards. That's the biggest thing. And I think I talked about that in the last video too. I definitely feel a lot of downwards pressure, which I'm not used to. So I have dialed things back in regards to exercise because I really don't want that pressure to become an issue in the future in regards to things like prolapse and stuff like that. I'm still exercising. I'm still getting good activations in. I just haven't been lifting nearly as much. And so that's been really hard to adjust to, but I know that that will be better for me in the long run. I just don't think I can properly control my pelvic floor and my core activations with the exercises I was doing. And so I've dialed them back. I'm doing a lot more body weight stuff. I am using some weights for some things. But yeah, a lot more just like core activations and making sure that I'm moving well and I'm keeping things activated in general around my lumbar spine and my pelvis and my core and all that kind of stuff. So yeah, that's kind of the biggest one is pelvic pressure. And he's been flipping a lot. So for the longest time he was breech and just like kicking straight downwards. And now he's definitely a little bit more transverse or sideways. He's kicking a lot more like up into my ribs, which I definitely prefer than kicking to my bladder, because kicking to my bladder just makes me feel like I have to pee 24/7 and it's not comfortable at all, especially when I'm working. Like, I'm still working full time. And so like, I'm just like trying to get my work done and I'm trying to treat my patients and all that kind of stuff. And then like I constantly feel like I have to pee and it's just very, very, very uncomfortable. So kicking to the ribs is definitely better than kicking to my bladder and my inner vagina. I talked about this in the last video too. There's definitely a lot of feelings, a lot of anxious feelings surrounding the measles outbreak, and a lot more at this point in the sense of like, what will happen if the measles outbreak is still happening when our baby gets here? I would be very, very anxious to have people over and to meet our baby and to hold our baby and all that kind of stuff if there's still a measles outbreak happening. And it's something that scares me, just being pregnant, because it's something that can cross the placenta. But then thinking about having a newborn during that situation just like brings that level of anxiety up so much higher. So that's definitely been on my mind. That's something that's been there. I'm doing much better with it than I was a month ago, but I'm just very nervous about what will we do if it's still happening in July. Something new that's been happening. I've noticed my gums are bleeding a lot more when I'm brushing my teeth. And it's not like they're not like gushing blood. It's just like I notice more than every once in a while they used to when I would brush my teeth. But now I'm just noticing it more. And so I think that's just, there's some sensitivity there. My blood volume is higher, like all of those kinds of things. Google tells me it's nothing to worry about. I'm going to bring it up to my midwife as well, but I don't think that's anything I need to be concerned about. That one's a little bit new, but also not all the time either. Like not every time I brush, but every once in a while I'm like, whoa, that's a lot more pink than I thought it was going to be. So yeah, that's interesting. And then the other new one is heartburn on and off. Like very inconsistently, depends what I eat, depends what position I'm lying in, but nothing that a Tums can't fix. Like I pop a Tums, it goes away, I go to sleep, and then the next day it's gone. Like I haven't had any that's just like really been sticking around. So yeah, that's been a little new and different. Not so great. I've never really had heartburn before and I'm not a fan. So I'm sorry to those of you who have it all the time. Like that really sucks. I've been experiencing a lot of very inconsistent aches and pains. So for example, my left hip has been kind of uncomfortable, kind of feels unstable. Again, not all the time, just like depending what I'm doing, depends how much I'm on my feet, depends how much I've walked that day. There are some days when I'm walking over 10 kilometers. So on those days, I'm obviously more sore than other days. My left SI joint has been kind of on and off. I've talked about that before. It's been on and off uncomfortable. Nothing that some exercises doesn't fix. I will be talking about second trimester exercise, by the way, at some point, I promise. And then on my right side, my ribs have been a little bit uncomfortable in the back. And so that's been a little bit new. I'm going to a chiropractor about once a month. And so I think I actually go next week. So that should kind of fix most of those things. I'm also taking something called Magnesium Calm. Let me go grab it. So I'm taking Magnesium Calm. It's this stuff right here. I just put a scoop of this, like a teaspoon, I think it is. I just put a teaspoon into like a bubbly water or something, like something of the sort. And I find that this, if you are pregnant and you're constipated, you're having a hard time sleeping, you are experiencing muscle aches and pains, this stuff is incredible. Incredible. It is so good. So I got this at, I want to say I got this at Superstore, but I know you can order it on Amazon if that's what you're into. I don't really know where all you can get it, but yeah, this is the best. I take this in the evenings because it does make me sleepy. So I take this in the evenings and make myself a little mocktail. This has been such a lifesaver. It's kept me very regular. and it's kept me feeling good. So definitely go check that out. I take it along with my prenatals. I'll also take my prenatals below. And if you use my code for prenatals, you will also get 10% off. So feel free to go check those out. I notice I get out of breath a lot faster, especially when I'm working and I am moving and explaining something at the same time. So a big part of what I do as an athletic therapist is I demonstrate exercises, and then I also explain to patients what's happening in their body. And so the more I talk and the more I move at the same time, the more out of breath I get. And so there are some times when I'm like, sorry, I just need a second. I need to catch my breath. My patients have been so good about it. But yeah, that's definitely something that I've noticed. And the last thing is like kind of random insomnia, sort of. I don't even know what to call it. Like I will wake up in the middle of the night. I need to go to the bathroom, like sometime around like 3 or 4. And I go to the bathroom and then I'm wide awake and I cannot fall asleep. And then because I'm awake, I'm hungry. So I have to eat something. And then also because I'm awake, my mind just like the gears start turning and I'm thinking of new ideas and I can't turn my mind off. And so that's been happening the last couple days for sure. And then it happened a few weeks ago, kind of randomly. So I'm hoping that doesn't last too long, but it has been very inconvenient because especially when I work an earlier day and then I usually fall asleep afterwards. Like I'll fall asleep for a few hours and then I wake up when my alarm goes. And so I'm not necessarily getting bad sleep. Like I'm getting good sleep when I'm asleep, but I just am waking up at very random times and then having a hard time falling back asleep after I've woken up. Okay, so I had my 4th midwife appointment 2 weeks ago. 2 weeks ago, I had my 4th midwife appointment. So at this appointment, she reviewed my gestational diabetes test, which was negative. She reviewed my blood work, which I thought my iron was low in my blood work. It was flagged as something that like needs to be kept an eye on, but she's like, it's perfectly fine as long as you don't have any symptoms. What were my numbers? I think I was at 40. No, I was at 63. That's what it was. I don't remember what it's supposed to be, but I was at 63. And so it was kind of flagged as like, could be low, could be a deficiency. And she just basically said, you don't have any symptoms, you don't have any risk factors, and you're still eating good food. Like I'm still eating eggs, I'm still eating meat, I'm still like making sure I'm getting protein in and all that stuff. And she's like, as long as you are doing that, there's nothing to be concerned about. So that put my mind at ease a little bit. So she talked about fetal movements as well. So they don't want you to count fetal movements unless you notice something is inconsistent. So let's say, for example, I didn't feel my baby move at nighttime when I lay down in bed like I feel him every single day. She then said, then you want to kind of count the movements. So over the next 2 hours, you want at least 6 fetal movements. And she basically said, as long as you're getting those movements in and you are feeling some movements, there's nothing to be concerned about. If not, then just give us a call and head into OB triage or whatever, and they'll check me out. He is extremely active. And so I really don't want to get it into my head that if he's all of a sudden not as active, then there's a problem. Like I very much want to be like, he's still moving every hour, like that sort of thing. So, cause she said he sleeps for about an hour and then he's awake for a little bit and then sleeps for another hour and then awake for a little bit. So they kind of go based off of like every 2 hours kind of thing. So she said just something to keep in mind, not necessarily something that we need to actually keep an eye on unless we notice that there's a difference. So then she measured my belly with a tape measure. This is the first time she's actually measured me. So she measured from pubic bone to top of my uterus. So pubic bone is this bone right here. So she measured from there and then she measured over my belly and then right to the top of my uterus here. And it was kind of funny, like she measured me and she said, oh, you're, what was I, 26 weeks at that point? She goes, oh, you're 26 weeks? And I said, yeah. And she goes, oh, you're just measuring kind of different. And I was like, okay. That's all she said. Like, she didn't really say anything else about it. Not that I would have any concern about that regardless, because that's like the least accurate way to determine how big or small a baby is, to be quite honest. That's what the evidence shows, just so you know. And then she found his heartbeat, which was 140 beats per minute, which was the lowest amount it's ever been. It's always been like 145, 150. And this time was the lowest that it's ever been. And he was also a lot more cooperative this time. Like, it didn't take her very long to find his heartbeat. But yeah, so that was good. So far, midwife appointments have been really good. I love my midwife. She's really easy to talk to. She's wonderful. Like, it's been really, really, really awesome working with midwives. And I'm really excited. Like, people ask me all the time if I'm scared of labor or if I like have a lot of fear around it or anxiety around it or anything like that. And honestly, I don't. I'm gonna do a full video on my birth wishes and kind of my birth plans. And I have a great team. Like, I have a really, really awesome team. I am very educated when it comes to the process of birth, what happens to the female body throughout birth, all of that kind of stuff. And so it doesn't scare me. Like, a lot of it is just very natural things. And when it comes down to it, like, no matter how much you prepare, it's just kind of like what happens is gonna happen. And when it's done, it's done. Like, you gotta kind of surrender to it. I'll talk about this all in another video, but anyways, yeah. So thanks for joining me for my 28-week video. Like I said, I am blown away that I'm in 3rd trimester now. And I'm also just I am so extremely thankful, and I am so blessed that I feel as good as I do. Like, I really am just so thankful, and I've just been loving this journey. And yeah, it's been the most positive, wonderful journey. And I said from day one, I said I will reap positivity throughout this entire process. And honestly, even when I feel like crap, like, there are some days when I get up off the couch and I'm like, oh, my body does not feel good. But I don't know. I don't have a reason to feel negative about it at this point. Maybe I will at some point, but right now I'm so happy. But anyways, thanks for joining in this video today, and I will talk to you guys soon.